Good afternoon, everybody. I take it that you're ready to go, so we'll get underway. Before I continue, just like to acknowledge Whipile Ai Margiapa, the Chief Executive of Te Whatu Ora Health New Zealand, and she will be here to answer questions alongside me at the conclusion of this presentation. So the purpose of today is just to brief you on a number of measures that we're taking to address the health workforce issues that we have in New Zealand at the moment. I want to begin by saying that here in Aotearoa, New Zealand, we are not alone in having to address some long-standing health workforce issues with the vacancies and so on that we have. Many other countries are experiencing what we've got, but we have to do what is right for New Zealand. Some of the measures that I'm announcing today are a continuation of measures that have started before the health system changes came into effect. But others that I'm talking about can happen now because of the changes that took effect a month ago. Can I begin by just acknowledging once again the pressures that healthcare workers in New Zealand are under as a result of the COVID-19 pandemic, the worst flu season in living memory, and unprecedented staff absenteeism, largely as a result of the first two factors, which have been extreme over the last few weeks. But I think we also have to acknowledge that the problems go back before that. The system has been under-resourced for a long time, even before we became government. A month ago, changes to the health system came into force, creating a single national health service. That means, on workforce issues, we can now have a single point of coordination and put some real heft into recruiting to the shortages that we have and to ease pressure on the health system. These changes simply weren't possible under the old disjointed and bureaucratic structure that we had. For the record, however, let me confirm the measures this government has already taken to boost the health system. We've increased health funding by 44% to this year a record $24 billion. We've committed $7 billion in an infrastructure program over the last 5 years to modernise many of our hospitals, and we still have some way to go. And we have an ongoing program for pay equity for more health workers as we seek to lift pay and remuneration for health workers. On the 31st of March this year, we had 1,765 more doctors in our public health system and 4,277 more nurses than were in our system before we became government in 2017. We have more vacancies in the health system now also, but that's because we are funding more positions. We are training more nurses than ever before, 8,190 in 2021 compared to 7,340 in 2017. And during the COVID-19 pandemic, we brought in 5,700 critical healthcare workers despite the fact that borders were closed. But now we've changed immigration rules to make New Zealand one of the easiest places in the world for health workers to come to. And in this year's budget, we made $76 million available over the next 4 years for workforce training and development. In my first address to them when they came into being on the 1st of July, I said to Te Whatu Ora Health New Zealand and Te Aka Whai Ora, the Māori Health Authority, that urgently addressing the workforce vacancies that we have is the top priority. So, just to confirm, the following initiatives are already underway. Firstly, expanding a successful program that we piloted this year that provides $5,000 in funding for every non-practicing nurse in New Zealand who wants to return to nursing to help get them re-registered. By the end of this year, the Return to Nursing Support Program will have helped 200 nurses in New Zealand get back into the health workforce. Many of them are in aged care residential homes. That scheme will expand next year with no cap and will be made more flexible to make it attractive to nurses who want to work part-time. What I found as I've got around is a lot of those nurses are saying, the former nurses are saying they want to get back to it, but they don't want to work full-time, they want part-time work, and we need them. So we'll make sure that scheme accommodates that. Secondly, we're providing financial incentives through the voluntary bonding scheme for newly qualified health professionals to work in communities and specialties that need them most. This year we removed the previous limit that was on that scheme and we have funded all 534 eligible applicants. Next, we've funded 54 nurses to complete the nurse practitioners training program This program is targeted at addressing key gaps in the workforce, including supporting more Māori, Pacific, rural and hard-to-reach areas, as well as communities with high deprivation. We will increase that number. We've aimed at roughly 50 a year. We will increase that to 100 a year from 2024. And to put that in perspective, we currently have about 600 nurse practitioners in our health workforce, and we want to continue to increase that because of the important role that they play. The next, supporting nursing graduates into employment by funding entry into the workforce programs. This includes nurse entry to placement, so that's new graduate nurses, new entry to specialist practice, so that's existing registered nurses going into particular areas, and the enrolled nurse support into practice program. So we have just over 1,700 registered nurses who were funded into placement through the nurse entry to practice or placement program. 231 enrolled nurses have been supported into clinical roles since the enrolled nurse support into practice program started in June 2020. And we have 234 new nursing graduates funded for specialist mental health and addiction work in this year alone. And then finally, in this list of items, recruitment campaigns that we have underway, including the mental health and addiction nursing program, international critical care nurses recruitment program. Both of those programs continue to run to attract more people into vital nursing areas. But there are some new initiatives as well. With Te Whatu Ora Health New Zealand and Te Aka Whai Ora, the Māori Health Authority, now in place, they, along with the Ministry of Health, Manatu Hauora, are working together to further boost the workforce. Te Aka Whai Ora has a specific role to grow and support the Māori healthcare workforce right across our health system and people working in kaupapa Māori services. We know the current winter pressures have had a high impact on Māori communities, and Te Aka Whai Ora is working closely with Māori providers to ensure they are well supported. So the following are additional initiatives that have commenced or about to be commenced under the new structures. Firstly, establishing an international recruitment service within Te Whatu Ora Health New Zealand. Te Whatu Ora Health New Zealand is now an accredited employer on the immigration website, and so it can facilitate bringing people into the country. With the recent immigration changes making it easier than ever to recruit overseas health workers to come here, it's important we have the right organisation to get the best for our health system. Te Whatu Ora Health New Zealand are now cleared to recruit into 1,980 roles, including nearly 1,200 nursing positions. They have nearly 7,000 health workers, including 3,200 nurses registered as interested in working in New Zealand. The International Recruitment Service will be a one-stop shop for recruiting health professionals into our health service. It will also offer immigration and registration services, making the process of moving to Aotearoa, New Zealand as easy and attractive as possible. The idea is that they not only do the recruitment, but they do the immigration stuff, the settlement stuff, so it is all dealt with together. That service will support all kinds of healthcare workers, doctors, nurses, allied healthcare workers, midwives and others. It will be a national service delivered locally to support the individual and their families to settle in Aotearoa, New Zealand. That service is scheduled to begin in October this year. Turning to general practitioners, we're working with the Royal New Zealand College of General Practitioners to boost GP training numbers to 300 a year. Currently, we have just under 200. We will work with the college to increase that number. To find ways to incentivise registrars, increase representation of Māori and Pacific registrars into GP training and investigating how training practices can be better supported. Secondly, for internationally trained doctors wanting to get registration, all doctors wanting to practice in New Zealand have to be registered by the Medical Council. Internationally trained doctors from non-comparable health systems have to pass the Medical Council's New Zealand registration exam, or NZREX as it is known, to get that registration. Te Whatu Ora is scoping a 6-month bridging program to better prepare qualified doctors from non-comparable health systems for working in Aotearoa, New Zealand. The course is fully funded for those enrolled in the program, and they will also receive a full salary during the 6-week clinical induction and 3-month training internship. Te Whatu Ora is also looking to pilot community-based internships for overseas trained doctors to complete their registration and to get into the workforce. Next is supporting internationally qualified nurses to get registration. So nurses who have qualified overseas are required to undertake a competence assessment program before they can get registration and work here. That can be costly and can take time. So we will reimburse nurses up to $10,000 each for the costs incurred to help remove any financial barriers to gaining registration. Another barrier is the repetition of processes and the length of time it takes for overseas trained nurses when they're seeking registration to work in New Zealand. I'm writing to the Nursing Council, Te Whatu Ora Health New Zealand, Te Aka Whai Ora, the Māori Health Authority, and the Minister of Immigration to get them to work together to eliminate the duplication in the process each undertakes in relation to each nurse. The problem there is there are very, very similar checks that Te Whatu Ora Health New Zealand does, that Immigration New Zealand does, and that the Nursing Council does to get a nurse registered in New Zealand, all doing very similar things. So if the things that are similar are just done once, that can reduce the time it takes to get registered. Turning to radiology registrars, we also will fund the training of more radiology registrars. This is a big issue in the cancer sector. Currently, we train roughly 100 radiology registrars a year. This will increase in increments to 115 a year from 2024. This will cut the time it takes, therefore, for cancers to be diagnosed. Getting those radiology registrars trained and in place will make a big difference to the cancer services that we offer. Turning now to a domestic recruitment campaign. The Ministry of Health and Te Whatu Ora Health New Zealand are working closely with the New Zealand Nurses Organisation to create, in fact not to create, but they've already created a youth-focused domestic nurse recruitment campaign called Real Nurses, which begins today. That campaign showcases nurses as a diverse, meaningful and rewarding career and will help to encourage more people to choose nursing as a career. It's a multimedia campaign, it's targeting young people, and it will run on Facebook, Instagram, TikTok, YouTube, Twitch, as well as online and outdoor advertising. So the website realnurses.co.nz is live. It provides information about nursing and specific career paths within nursing. The campaign also includes a partnership with Shorten Street, that's the TV program, to attract more young people into nursing careers and to encourage nurses to return to practice. The partnership involves the campaign being integrated into the show's storyline, which apparently is a first in the show's 30-year history. Now turning to people who we want in the health workforce but turning up into non-clinical roles. We had a lot of people join the vaccination campaign last year in non-clinical roles, or at least who weren't clinically qualified but working in that campaign. So we want to encourage as many of them to enter the health workforce on a longer term basis and to become candidates for more formal training. There are an initial 25 people out of that vaccination campaign last year who are now working in hospital supporter roles at Auckland Hospital, and Te Aka Whai Ora, the Māori Health Authority, will support many more to do the same. Their role right now is to support frontline registered nurses to do their job and alleviate some of the tasks that they would otherwise have to do. Te Aka Whai Ora, the Māori Health Authority, has a specific role to grow and support the Māori healthcare workforce and to ensure Māori providers and the communities they serve are supported, and this will help that. Just a couple of issues finally I want to touch on. The first is pay parity. We know this is a major issue in the primary care sector, that is to say GP clinics and also aged residential care. So what I can say in relation to that is that apart from our desire to lift wages of nurses in those roles, ministers, myself and others, will shortly be receiving advice on how we can get a pay parity process underway for that sector of the workforce, and I expect that process will start soon. Finally, I just want to say that there are a range of things going on. There's more long-term work that is needed as well. Te Whatu Ora Health New Zealand has a workforce task force in place looking at some of the issues that deal with training institutions, what we call the responsible authorities, things like the colleges and the professional groups that oversee the various health professions, to look at longer term training issues, scope issues within professions and roles and so on as well. We are able to do what we're doing in terms of the new initiatives now because we have a structure in place that is nationwide and that can bring the level of coordination and, most importantly, I think the heft when engaging with the range of other organisations that get involved in preparing and creating our health workforce to start to make the change. This will set us up to now focus very much on what it needs to build that long-term pipeline of health workers for the future of the health system. But as I acknowledged just before, we also have to acknowledge that the healthcare workforce of the future may look or be somewhat different to what we are used to do today in terms of the range of skills held by a single person, the range of qualifications that we have available, and that is all work that we need to get underway, not just with the government organisations, but through the sector, those working in it, the professions, the colleges and others as well. And I'm hoping that we'll have an opportunity in the near future to enable that conversation and that bit of work to commence. So on that note, I will conclude my remarks, but I'll invite Whipulei Margiapa to step up here with me and we will answer any questions that you have.
So one of the criticisms was, in terms of the immigration, was that nurses weren't given the same residency opportunities. Why hasn't that been addressed, and what does dedicated immigration support services mean or look like?
So I've just explained the single kind of immigration centre, the single desk that will now operate to run for the offshore recruitment. So that'll be both doing the recruitment and then for those who are applying through that process, dealing with their immigration issues, dealing with their settlement issues as they arrive here and get settled in wherever they are deployed to in New Zealand. So in relation to immigration, we know that having overseas qualified health professionals is very important. Te Whatu Ora Health New Zealand is already cleared through the processes that have been in place to recruit at the moment 1,980 health professionals, including nearly 1,200 nurses. We have roughly 7,000 health professionals registered from overseas as wanting to work in New Zealand, and over 3,000 of those are nurses. So I don't think that we are going to have difficulty recruiting whether nurses or any other health professional, whether it's midwives, allied health workers or others, offshore. What we have to make sure is we've got a good process to manage that.
What's going to change now? Because these shortages have been apparent. We haven't been able to recruit the number from overseas that we've needed. So do you really think that this is going to make a difference, actually attracting people when there is that, not such the same offer for nurses as there are for doctors?
Well, I've laid out what the numbers are in terms of those who are expressing an interest in wanting to work here, and when we talk to them, we know that some of their issues are just getting across the border, so getting their immigration issues sorted, getting their settlement sorted. We know, as I've talked about, some of the issues about getting their registration to the New Zealand professional bodies, and we've got measures now to deal with that as well. So all of those things that are barriers to getting in and actually getting on the floor of a hospital and working, these are the issues designed to deal with that.
You've used words such as pressure, issues, etc. Why not come out and just call this a crisis, as the opposition and many people have called you to label this?
Yeah, look, I don't care what words people use to describe the extraordinary pressures that our system has been under and the shortages that we've got. We've got shortages. We've been carrying shortages for some time. When we talk about vacancies, we're talking about positions that are funded. What's most important is that we get people in to fill them. That's what's going to alleviate the pressure, and that's what we're focused on doing. I know you've asked the question before, and people got all sorts of language to describe it. We have a system that has been under, continues to be under extraordinary pressure, but we've got an excellent frontline management who've been doing the best they can with the workers. They've got the workforce that we've got to meet the needs of those who are turning up to our health system. What we have to do is focus on what we need to fill the vacancies that we've been carrying for some time.
What does success look like for you in terms of how many nurses and doctors and radiologists come into the country? Have you got a specific number in mind?
Look, we just want to move as quickly as we can once we have that, and we want the people who want to come and work in New Zealand because it's an attractive place to work, having the best experience they can for getting here, for crossing the border, for settling in and getting into work in New Zealand.
Is tikanga and mōhiotanga on te tiriti part of the assessment for incoming workers?
It's part of the training they get once they get here and part of their competency assessment. That is part of the stuff they have to learn.
Will be tikanga based and part of the knowledge of the treaty?
In terms of the competency assessment program that they do, I'm not sure of the proportion. I don't know. Marge,
Is
whether you
it
have
part of the training and development is in the program, and it's been piloted in the Northern region, and we are going to spread that around the country, and we have Te Aka Whaiora giving us advice on what more we can do. And you know, we've had interest from around the world because people are interested in what New Zealand is doing in Indigenous health, so we're really you know, emphasising the support for people coming into the country to be fit for our community is really important.
How many nurses and doctors do you think haven't come to New Zealand because of the issues around having their qualifications recognised here? And you know, what sort of impact do you think the support these new pathways will have on that?
It's hard to quantify that, but certainly as I get around and look at the representations being made to me, we know that is an issue, and you hear, you know, of overseas qualified nurses waiting 4 months, 6 months to get their qualifications recognised. So we need to shorten that. So anything we can do to shorten that will make it easier.
You said that where you might have, you know, the health system might look different in terms of skills. Are you basically saying that plugs will be filled with people who aren't as skilled as we would traditionally expect a nurse or a doctor, or a nurse in particular, to be?
No, I'm not saying that at all. What I'm saying is that when we think about what the future of healthcare looks like, the needs of people, and as we want the system to adapt to provide more care in the community, what the range of skills that health professionals have will need to change. So it's not about having unqualified or less qualified or less skilled people doing it. The opposite is the case. Actually, we need to beef up our training, expand and broaden skills, and we need multidisciplinary teams operating as well. Health professionals recognising that they can't do sort of everything they might like to do. They have to work with other health professionals to provide the best service available to communities. So, Bernard.
That 1,980 number,
yep.
How much of an increase does that represent from previous years? And how much of the hole, if you like, does it fill? How big is the hole of the empty the vacancies?
Well, we know we have roughly 3,300 nurse vacancies in the public health system at the moment. So that number is because Te Whatu Ora Health New Zealand is an accredited employer now. That is the number that they've now got, in a sense, got a permission to recruit into, and they've got this register of roughly 7,000 health professionals from overseas expressing an interest in working into New Zealand. So they can sort of get underway. That number will change, it will grow as Immigration New Zealand under the verifies that A, there are vacancies, and B, it's difficult.
Like the past kind of about what the conversion rate is between from nurses who say express an interest in coming versus those who actually end up coming?
I'm not quite sure.
No, and I think part of the value of having a nationalised recruitment service to support that is that we have had different approaches to looking after people overseas who are interested in coming to New Zealand, different approaches to onboarding, different approaches to engaging them, and we know that those districts that have done a good job of keeping our talent overseas in touch with us have done a good job of actually converting that. So that's the point of a national recruitment service, is to give people a more consistent experience and all the information they need to make a move to New Zealand.
So Immigration New Zealand doesn't have any figures on people who have looked into coming over as nurses and then eventually coming over at all in the past?
No, we can have a look at what we've got.
Yes, at the back.
Obviously, higher pay in Australia is a big driver for shortages. Will New Zealand ever really be able to compete with Australia? And how will this be announcement sort of stop stuff to promote in Australia?
We won't stop New Zealand nurses, New Zealand qualified nurses from wanting to work overseas. We know they do that, and many do, and then most come back. But we know that nurse pay in New Zealand has been, lower than it should be. That's why we A, changed the law on pay equity, and B, have embarked on pay equity deals. We've got deals with a number of other groups. We've got the admin and clerical workers in hospitals. We're negotiating with the midwives at the moment. And we're about to start, I think, with the allied health workers who meet the criteria. So we're doing what we can through the pay equity process to significantly lift remuneration for health workers. We have a deal with the nurses that's being litigated at the moment, but we remain committed across the health workforce generally to lift pay from the kind of the unfair levels they've been in for a long time to better levels. So just to follow up, Kirsten, yeah.
Is New Zealand still competing though in Australia for international health workforces? Can it ever really truly compete with Australia?
Yes, we are, because we're an attractive place to work and we're an attractive country to live in. Even during the pandemic, we've still got 5,700 odd people across the border to work in our health system. So, and we have 7,000 people sitting on a register saying they want to come and work in the New Zealand health system. So I'm confident that we will.
Exactly how many Māori in Pacifica are you targeting to bring in? Exactly how many?
Well, we don't have a specific number, but we know we need to increase that part of our health workforce. So,
and
one of the
are they in charge of recruiting Māori, and who will be taking care of Pacifica?
Te Aka Whai Ora they have a specific mandate to grow and develop the Māori health workforce. They will both Te Aka Whai Ora and Te Whatu Ora Health New Zealand will work on the rest of the workforce, including the Pacific workforce too. There is a dedicated Pacific directorate that deals with a range of issues, but one of those is workforce as well.
Why is there no target for Māori?
Well, we know we need to grow the number, so we don't want to limit ourselves. And we know that Te Aka Whai Ora, through the work they're doing even now, has ambitions for a number of programs to get more Māori into the health workforce, a number of range of different kind of entry levels that they've got for that, but it is about just growing that number.
How
So
soon
over the
do you see this making a difference? Has it come too late for this?
The winter is, we're sort of substantially the way through it. As I said before, we know we've had workforce challenges in terms of vacancies we've had to fill for some time. So it's never too late to get on with it. I think in terms of planning for this winter, we planned for a very difficult winter. I think it's probably fair to say it's worse than we expected. I think one of the whole reasons for revamping the structure of our public health system is precisely because the system as it was simply not demonstrated that it wasn't capable of dealing with the chronic problems that the system had. We now have a system, I am confident, that is much better able, through better coordination and streamlined processes, to do a much better job in filling those long-standing vacancies.
2 weeks ago, you defended the government's handling of the health system, saying that you'd funded an extra 4,000 nurse places.
Yep.
How many in total have been filled out of those 4,000?
Well, if you look at the numbers, there's roughly about 1,200 additional nurses, full-time equivalents in place in our health system than from when we funded those positions.
Could you?
On pay parity, what do you mean by a process? I mean, surely it's just a matter of paying nurses the same whether they work in aged care or in hospitals.
Yeah, I think because you've got literally thousands of employers, and not all of those, the personnel covered by those employers are in a union. So you've got to find a process where you effectively negotiate, because there might be different views about what parity actually means when it comes down to the brass tacks, and you've then got to create an enforceable agreement. So it's not as easy as just saying, we'll look over there, that's what they're being paid, we'll pay all this across such an atomised employer workforce as well as an extensive workforce on its own.
How much of these announcements will impact the mental health workforce that you're obviously trying to grow in terms of what was budgeted in 2019 and where you're at with that?
Yeah, I mean, I talked about some of the nurse entry to specialist practice work, 230 odd nurses going to that work just this year alone. I think the announcement that I made on Friday will probably be of significant benefit, particularly as we continue to fill the remaining frontline roles as part of our Access and Choice program. So allowing the qualified skilled counsellors now to be accredited and to pick up, for example, the health improvement practitioner roles means we have another pool from which to draw to fill the remaining roles that we have planned to roll out over the next sort of couple of years. So that will help with that.
So you're comfortable that that sort of big gap that you had there will be mostly filled in terms of what was announced on Friday?
Yeah, I mean, yeah, like it was always a 4-year program to complete the rollout of that, and slowed somewhat because of COVID. So you might say 4.5 to 5 year program, but we're on track. We knew the last sort of couple of years would be challenging because of where we are drawing that workforce from. We now have another pool from which to draw. Mikey, and then Jason. Yeah.
Just another question for a colleague on pay parity. What, if anything, needs to be done in terms of doctors? For example, public health specialists being paid considerably less than orthopaedic specialists?
I'm not quite across to that issue, but Margie will have it.
That is one of the areas that we want to add. We want to give all trainees an equitable experience in medical training. And so public health, and the first announcement is addressing primary care, and we're looking at public health specialists now.
And when is the government going to commit to funding higher intakes at our medical schools? Why has there been no increase in student numbers for more than a decade?
So there's a number of complexities to that issue. It's not just a question of putting more numbers there. I know that the medical schools are very keen to take up those numbers. We have to make sure that with those coming in, that we've got places for them to go in their first and second professional years. So that's been the issue there. But I can say that that is under active consideration about what we do and how we approach that at the moment.
So when you're talking about increasing the GP training by 100 from 2 to 3,
yep.
How do you envisage that happening?
That's work that's underway at the moment with the Ministry and the Royal College of GPs to work out how that works. I also talked about the program we've got at the moment where those who want to be a GP can do their supervised years in the community in primary care as opposed to going to a hospital, which is where they will go to now, which is where often somebody who aspires to be a GP ends up working in a hospital and quite likes that environment. So we're very keen to create opportunities for supervised practice to happen in the community in primary care. We expect we'll be able to grow that, but that'll be work that the Ministry and the Royal College of GPs will work on together.
Are there any downsides to that in terms of not getting the same exposure to different experiences as being in a hospital compared to kind of being at a primary health care?
It might be more about who is the lead. So if it is a person who aspires to be a GP starting their supervision in the community, you will want them to rotate through a hospital setting. I think there's a really good model that the old West Coast District Health Board did, what are we calling it now, the West Coast District now under Te Whatu Ora Health New Zealand operates, which is and it's the Rural General Specialist Program where doctors get exposure to both the hospital setting and primary care setting. And they have employed doctors who once they are fully qualified, are working in the primary care setting as well as the hospital setting. So, Jason.
Just two things to add to that, Minister. We don't think it takes away from training. Even if a medical trainee ends up in hospital, having had a substantial experience in primary care gives them a whole of system exposure to how patients experience care. And the other piece of work we're doing is working with primary care practices so that the training experience of trainees and we know that there are lots of practices who want to provide a training experience but need support from the college and ourselves to help them do that. So that's all part of the package of increasing the number of GPs that we have in the system.
Can I ask a follow on that, sorry?
Yep.
So you just said before that in terms of increasing the numbers that go through medical school, the medical schools want to do that, but it's the difficulties in the first and second year rotation. Is that, reading between the lines, are you saying that there aren't the sort of doctors with more experience to manage and oversee and the guidance, they aren't there to have more come in that first and second year rotation? Is that the problem?
They don't have the capacity for the extra kind of supervision that would be required. We've increased the number of graduates who are absorbed by the system anyway, so we're up to about 230 odd medical graduates in the system with supervision. There isn't the capacity to do more at the moment, so that's why that number has been held back.
That's slightly ironic, isn't it, that you kind of can't increase the number of doctors because
It's a catch-22 situation, yes, and that observation has been made, indeed, yes. Jason,
Will
sorry.
moving into primary care solve that?
It means that those who want to work, whose ambition is to work in primary care, whether they're overseas qualified or New Zealand qualified, for them to do the remainder of their training in that environment as opposed to a hospital environment. So yes, yeah.
Could
Jason.
you just walk me through the Shortland Street element of this? What's been
they will assist with promoting nursing as a fantastic career, which it is.
So how does that work in practice? So is the government funding Shortland Street to say how good nursing is in New Zealand?
I think it's a sharing of information so that they know, they may even talk about or use the material that is available to promote nursing.
Are they going to talk about the recruitment campaign and like sort of act as though there is a recruitment campaign going on for the hospital?
I think they're a little more
Social
subtle than
Street
that.
might want us to hold.
Yes, I think it's a little bit.
The storyline.
We're not-
how they do it to them.
Do you not ask public servants to enter the creative sector and sort of work out how that happens? We'll leave the creative sector to sort that out.
Is the government providing funding to the producers of Shortland Street to deliver this message?
As I understand it, or as I am advised, there is an agreement as part of the campaign to talk about nursing and what it entails, as Shortland Street is going to play a role.
Are
So
you paying for that?
I'm not aware of any payment for that.
Minister, just more broadly on that, on Shortland Street and the recruitment drive on TikTok and Instagram, etc. Is it worth funding that when the issues around many areas of pay aren't sorted out? Isn't the biggest driver and incentive for people to get into nursing better pay?
Yeah, well, we are addressing the pay issue, and we now have to litigate that, but we are addressing that issue. I think what's important is that, you know, young people are thinking about the jobs they want to do, the careers they want to enter all the time. So there's never not a time to be having good information and attractive information available about particular career choices. So at the back here.
What initiatives do you have planned to help out allied health workers such as pharmacists who are experiencing the same workforce pressures?
Well, we have hospital-employed pharmacists who will be part of the recruitment work and workforce development work that Te Whatu Ora Health New Zealand and other entities are doing. Beyond that, there's no other particular issues yet.
This is our short-term initiative, so this is immediate action at the moment, and we are working on an allied health pathway, both for increasing pharmacists, but also widening what pharmacists can do for our community. You will have seen that antiviral vaccination are all the kinds of services that if we can support pharmacies to do is much more accessible to large parts of our community. But there are allied health as part of the medium-term wave of work that we're doing.
Minister, have you got the funding organised and guaranteed for increasing pay in the pay equity agreements?
Yes, there's contingency funding for pay equity payments. Yeah.
Can you say how much?
There's, with a lot of the pay equity deals we're doing, there are still negotiations, except to say that, you know,
And doctor salaries, is there a funding team on it?
The immediate actions are about 14.4 million, and that's a start.
I have parity for
Sorry,
whānau
Tony.
Māori working in Hauora Māori.
Mhm.
So when will we be able to see an increase in funding, equitable funding for our whānau working in Hauora Māori as opposed to non-Māori?
If they're covered by the pay equity agreements that we have done or are doing, then they will benefit from that. If it's about lifting pay through the funding contracts they have with the funders like Te Whatu Ora Health New Zealand or Te Aka Whaiora, the Māori Health Authority, then that will follow whatever negotiations they do with those bodies.
Yes, because Ngāti Toa Rangatira, as an example, that second case.
All right.
So when will they be able to see an increase in kutia for their health workers?
Well, that'll be a matter they deal with when they're dealing with Te Aka Whai Ora. When their funding contract comes up for renewal next, that'll be an issue that they will deal with at that time.
Australia announced last month that it was expanding its Pacific Worker Scheme to include the aged care sector. Was that something that you looked at or are looking at potentially for Pacific aged workers to train here?
We don't have a specific program to attract Pacific workers into our aged residential care system. Our focus in aged residential care and primary care at the moment is assisting them to recruit, and a key part of that is pay parity, which is why that's become or is the priority that it is.
But the International Qualified Nursing Scheme is open to anyone in the country.
That's true. All right, unless there's anything else, thank you very much.